Sensory integration model. Jane Eyre studied the relationship between children's learning disabilities and their problems in interpreting sensation from the body and their environment. She designed the sensory integration model for children with sensory processing and learning disabilities. The sensory integration model is a conceptualization that provides a clean account of the nature and role of motivation in sensory integration. The inner drive of humans leads the individual to seek out and engage in sensory motor activities and provide opportunities for sensory intake. Assessment tools. The primary assessment tool is a sensory integration and praxis test for ages 4 to 8 years. It is used to assess tactile processing, vestibular proprioceptive processing, visual perception, and practice planning ability. It is a series of 17 individually administered tests in 90 minutes. Other assessments include the sensory profile, the gravitational insecurity assessment, the test of ideational praxis, and the sensory processing measure. Strengths and weaknesses of the sensory integration model. Some of the strengths include that there was a meta-analysis study performed by Ottenbacher in 1991 that concluded treatment effectiveness of sensory integration therapy. Variability in treatments administered in sensory integration research studies may be in part due to the fact that sensory integration is individualized and frequently adapted based on a child's changing needs. Parents and therapists were very enthusiastic about their first-hand experience with sensory integration-based therapy because the therapy produces positive outcomes. Some of the weaknesses include Bundy et al. In 2002 concluded that evidence concerning the effectiveness of sensory integration-based therapy was mixed at best and downright negative at worst. Vargas and Camilli in 1999 used meta-analysis to examine studies reported between 1983 and 1993 and found very little evidence for treatment effectiveness. Because treatment is individualized to the child based on his or her needs, research studies are not ideal for capturing change in the participating children.
Intervention strategies and methods. The interventions vary on the sensory needs of the child. You need to provide sensory opportunities, including tactile, vestibular, and or proprioceptive experiences. You need to provide the just right challenges. They can't be neither too difficult nor too easy to evoke adaptive responses. Collaborate on activity choice. Allow the child to exert some control. Do not predetermine a schedule of activities independently of the child. Guide self-organization. Support and guide the plans of the child. Encourage the child to initiate and develop ideas and plans for activities. Support optimal arousal. Ensure that the therapy is conducive to attaining the child's optimal level of arousal. You need to create a play context, build on the child's intrinsic motivation and enjoyment of activities, facilitate or expand on social, motor, imaginative, or object play. Maximize the child's success. Present or modify activities so that the child can experience success but also be challenged. Ensure physical safety. Arrange the room to engage the child. And foster therapeutic alliance. A note on fidelity. When implementing sensory interventions, the occupational therapist must ensure that their treatment plans follow the fidelity instruments to establish treatment integrity and verify that the intervention was delivered as intended using empirical measures.
I can rise above. Hi, my name is Ellie. I am 10 years old and I live with my mom, dad, brother, sister, and my dog, Linus. I love to wrestle with my family. We get all tangled up. I love to jump around in puddles. I really like it when I splash my dad. I like quiet places and going on walks outside. But when I was 7, things were not very easy for me. It was hard for me to read because I stumbled over words. I liked it when my mom read to me. It was hard for me to ride my bike because balance was not my strength. It was hard for me to make friends, so I played by myself a lot. This is Miss Lucy, but I call her Luce. She is beautiful like a princess, and she has come to help me. These are some of the things we did in therapy. They were not only fun, but were very helpful to me. We worked really hard together, and now I can read all by myself. We started with sounds, and now I can read chapter books. I can ride my bike. We started working on my balance, and now I can ride on 2 wheels. I never ride without my helmet. We worked very hard together, and sometimes I just needed a break. Luce and I worked on making friends. Now I have lots of friends, and we have so much fun. But most of all, Luce helped me to be self-confident. I am happy to be me. The end.